Hello there, warriors. Today we are taking a closer look at one of the world's most effective ancient remedies. Ginger, the root of the Zingiber officinale, has been praised for centuries not only as a versatile spice in cooking, but as a key component of traditional ancient medicine. With potent bioactive compounds like gingerol, which is a powerful antioxidant, and properties that aid the digestion process. It has been touted for its applications in alleviating pain, relieving menstrual pain, supporting the immune system, and lowering blood pressure, among many other benefits. While the positive benefits of ginger seem to be potentially limitless, there are certain health conditions where you might have to exercise caution or even absolutely avoid ginger. Ladies and gentlemen, stay tuned to find out the health problems where you should avoid consuming ginger in this ultimate guide to ginger and health. Don't forget to subscribe to our channel. We look out for your health with amazing wellness tips for a healthy life, and we would love for you to be a part of our community of warriors. Number 1. Bleeding disorders. If you have bleeding disorders, it's crucial to be cautious about your diet. Hemophilia is a bleeding disorder characterized by a deficiency or dysfunction of clotting factors in the blood and can cause prolonged bleeding after injury or surgery. Ginger contains compounds that have antiplatelet properties. Platelets are blood cells that play a crucial role in the formation of blood clots. Ginger's antiplatelet effects mean that it may interfere with the normal clotting process. Anticoagulant medications or blood thinners, such as warfarin, are prescribed to prevent blood clot formation. These medications work by inhibiting the clotting factors. Combining ginger, which also has antiplatelet effects, with anticoagulant medications could potentially enhance the blood thinning effect, leading to an increased risk of bleeding after an injury, surgery, or dental procedures. Number 2. Scheduled surgery. Similar to bleeding disorders, surgeries carry a risk of bleeding which needs to be controlled. Ginger contains bioactive compounds that have antiplatelet properties. These compounds can affect the aggregation of platelets, which are essential for blood clotting. In surgery, the ability of blood to clot is of utmost importance to prevent excessive bleeding during and after the procedure. If ginger is consumed close to the time of surgery, its antiplatelet effects could potentially increase the risk of bleeding during surgery, which can complicate the procedure, potentially leading to longer operating times and increased risks. After surgery, prolonged bleeding may pose challenges in wound healing and increase the likelihood of post-operative complications. To ensure safe surgical outcomes, it is crucial for individuals to inform their healthcare providers about any herbal supplements they are taking, including ginger. This information allows healthcare professionals to make informed decisions about the timing of surgery and any necessary adjustments to the preoperative routine, such as a curated diet. Number 3. Gastrointestinal disorders. While ginger is considered as a digestive aid, there are times where it could potentially do the extreme opposite and worsen health conditions. Ginger contains bioactive compounds, such as gingerol, which may relax the lower esophageal sphincter or LES, a muscle that separates the stomach from the esophagus. When facing acid reflux, a weakened or relaxed LES can allow stomach acid to flow back into the esophagus, leading to heartburn and discomfort. Peptic ulcers are sores that develop on the lining of the stomach, small intestine, or esophagus. While ginger has anti-inflammatory properties and is often considered soothing to the digestive system, it may stimulate gastric acid secretion. In individuals with peptic ulcers, increased stomach acid production could potentially worsen ulcer symptoms or delay the healing process. Number 4. Pregnancy. Ginger has been used for centuries as a home remedy in various cultures to alleviate nausea, including the nausea associated with pregnancy, commonly known as morning sickness. The active compound in ginger, gingerol, is believed to have anti-nausea and anti-inflammatory properties, which contribute to its potential effectiveness in reducing nausea and vomiting. Despite its traditional use and some positive results in smaller studies, there is a lack of high-quality, well-controlled clinical trials, specifically addressing the safety and efficacy of ginger for nausea in pregnancy. While moderate amounts of ginger used in cooking are generally considered safe during pregnancy, there is less certainty about the safety of ginger as supplements. Some studies suggest that ginger may have uterine-stimulating effects. Uterine stimulants increase the tone of the muscles in the uterus and are used for inducing labor. At an early stage, these stimulants could induce abortion and carry a risk of pregnancy complications. This raises concerns about the potential impact of ginger on the developing fetus, particularly in early pregnancy. Each pregnancy is unique, and factors such as the specific health conditions of the mother and the gestational stage may influence the safety of ginger use. Number 5. Gallstones. Gallstones are solid particles that form in the gallbladder, a small organ beneath the liver. They are made up of cholesterol, bilirubin, and other substances, and can develop when there is an imbalance in the substances that make up bile, a digestive fluid produced by the liver to aid in the digestion of fats. The size and type of gallstones can vary, ranging from small particles to larger solid stones. Bile is stored in the gallbladder and released into the small intestine to aid in the digestion and absorption of fats. It is a complex fluid that includes bile acids, cholesterol, bilirubin, and other components. Ginger has been studied to stimulate the production of bile. While this can be beneficial for some individuals, for those with gallstones, it might pose a concern. The presence of solid particles in the gallbladder can cause pain and discomfort, especially if the stones block the normal flow of bile. Ginger's potential to stimulate an increase in bile production could lead to an increased risk of symptoms or complications in those with existing gallstones. The contraction of the gallbladder muscle is part of the process of releasing bile into the small intestine. If someone has gallstones, the contraction of the gallbladder could potentially lead to the movement or lodging of gallstones, causing severe pain and complications. Number 6. Diabetes. Ginger has been studied for its potential hypoglycemic effects, meaning it may lower blood sugar levels. While this can be seen as a beneficial point for individuals with diabetes in terms of managing blood glucose, it also poses a concern for those already taking medications to lower blood sugar. Individuals with diabetes are typically on medications such as insulin or oral hypoglycemic agents to regulate blood sugar levels. If ginger is consumed alongside diabetes medications, it may enhance the blood sugar lowering effects of these medications. This can potentially lead to hypoglycemia, low blood sugar, a condition that can have serious consequences if not promptly addressed. It is necessary to advise your healthcare provider about the limit of how much ginger can be consumed, or whether it should be avoided. Number 7. Heart conditions. While ginger is considered as valuable in promoting heart health, its potency is also its limitation. Ginger has been studied to have potential effects on blood pressure. Some studies suggest that ginger may have a hypotensive effect or ability to lower blood pressure. While this can be beneficial for individuals with hypertension, it may pose a risk for those with already low blood pressure or individuals taking medications to control blood pressure. Ginger also has antiplatelet properties, meaning it can inhibit the formation of blood clots. While this can be advantageous for some individuals, such as those at risk of cardiovascular events, it may pose a risk for individuals with certain heart conditions or those taking anticoagulant medications. Ginger may interact with these medications commonly prescribed for heart conditions, such as beta blockers, calcium channel blockers, or anticoagulants. These interactions could potentially alter the effects of these medications or increase the risk of side effects. Oh my dear warriors, ginger might be considered as an integral part of ancient medicine and home remedies, but its potent medical benefits are also its drawbacks. If you have any of these health conditions, you need to watch out about the limit of ginger in your diet or avoid it completely. As always, it is best to advise your healthcare provider before making dietary changes. Cheers to wellness and health. This is Wellness Warriors with another life-changing experience on how to take control of your healthy lifestyle. Please like, subscribe, and turn on the notifications so you don't miss out on the latest health tips and tricks to a better life. Thank you for watching. See you again next time on Wellness Warriors.